Welcome to Roadmap to Residency Evidence-Based Applications. Hello everyone, I am Aviraz. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on your journey to 250. We are starting our reproductive system modules, and this is about male reproductive anatomy. So here we have if malignant, this patient's tumor is most likely to spread to each of the following lymph node groups. Now, the lymph node drainage of the uh, reproductive system is very important and is very commonly asked in the USMLE step 1 examination. So you need to know about some of the inguinal or some of the lymph node drainage, the para-aortic and all, which is very commonly asked in the examination. So here we have a 23-year-old woman, a 23-year-old man who comes to the physician complaining of right-sided testicular swelling. He first noticed the swelling 1 week ago while getting ready for work. He denies any testicular pain or history of trauma. However, he has noticed a heavy pressing sensation involving his scrotum and lower abdomen. Physical examination reveals asymmetric swelling of the right testis, and subsequent ultrasonography shows a solid testicular mass. Now, if it is malignant, then obviously there will be lymph node involvement. So this patient's tumor is most likely to spread which of the following lymph node groups: superficial inguinal, deep inguinal, external iliac, common iliac, inferior mesenteric, or para-aortic. So, the para-aortic lymph node receive the lymph drainage from the testis. The deep inguinal lymph node receive the lymph drainage from glans penis and superficial nodes. And the superficial inguinal nodes receive the lymph drainage from the scrotum. So at least these three group of lymph nodes you should remember by heart. And as I've said, very important for the examination. So again, we have another group of under question here. So this patient's testicular trauma most likely to damage an anatomical barrier from which of the following components. So a 34-year-old man is found to have a low sperm count during an infertility evaluation. The patient has no chronic medical condition but has a history of testicular trauma from a motorcycle accident several years ago. Vital signs are within normal limits and physical examination shows no abnormalities. Further evaluation reveals the patient has developed anti-sperm antibodies, and this patient's testicular trauma most likely damaged an anatomic barrier from which of the following components: Leydig cells, primary spermatocytes, secondary spermatocytes, Sertoli cells, or tunica albuginea. Now, we can see this is the basic structure of the testis and the cut section. Here we have the epididymis, okay, and then this is the cut section of the testis where we can see the outer fibrous capsule. Now, if you zoom in, you can see that this is the lumen containing mature sperm, and here is the developing sperm, and this figure shows you the basic physiology behind the spermatogenesis. So there are the Sertoli cells and there are the Leydig cells, okay, and the Leydig cells secrete the luteinizing hormone. So L4L, again, a very important concept required for the examination. So this is only a basic seminiferous tubular anatomy and a picture showing you a developing sperm and the mature sperm, how it gets detached and falls into the lumen of the seminiferous tubules. So it is a tubule, so tubular structure containing a lumen where there is a mature sperm. So talking about the spermatogenesis. So there is a one spermatogonium which undergoes mitosis to form the daughter cells. Okay, so mitosis means there will be equal number of chromosomes 2n 2n. If there is meiosis, then that is division of the chromosomes. So 2n will become n, a single n. So there is a spermatogonium which undergoes mitosis to form daughter cells, and then the meiosis 1 begins and forms a primary spermatocyte. So as I've told you, when there is meiosis, there is division of chromosomes. So when there is meiosis 1 completion, there will be a haploid group of chromosomes cells, which is called a secondary spermatocyte. Then again, there will be division of these cells to form early spermatids. Now, these early spermatids will undergo morphological changes to have the head, to have the body, to have the tail, to have the acrosomal cap and all. And these will be called as the latest spermatids. And when these latest spermatids, they fall into the lumen of the seminiferous tubule, then it is called as a mature sperm or spermatozoon. So seminiferous tubules are bounded by a basal lamina with columnar Sertoli cells extending from the basal lamina to the lumen. The Sertoli cells are connected by a continuous barrier of tight junctions, forming a functional boundary between the outer basal compartment and the inner luminal compartment of the tubule. Now, these tight junctions form the blood-testis barrier, which controls the environment of the developing spermatids and prevents immune exposure. So undifferentiated germ cells or spermatogonia reside along the basal lamina between the Sertoli cells and outside the blood-testis barrier. Now, when the spermatogonia are continually replenished by mitosis, during differentiation, the spermatozoa pass through the barrier, which reforms behind them. So disruption to this blood-testis barrier, example trauma or ischemia, can lead to formation of anti-sperm antibodies, which can impair the fertility. So again, we have one more question with us. So which of the following lymph node groups is most likely to be tender and swollen? So again, this question is asking us about the lymph node involvement. So 31-year-old man comes to the emergency department complaining of right-sided scrotal pain and swelling that has gradually worsened over the last 3 days. His temperature is 101 degree Fahrenheit. On physical examination, his right hemiscrotum is warm, tender, and erythematous. The cremasteric reflex is present, and scrotal ultrasound reveals the fluid collection consistent with superficial scrotal abscess. Now, when there is abscess, when there is infection, lymph node will be involved. So, which of the following lymph node groups is most likely to be tender and swollen in this patient? Common iliac, inferior mesenteric, infraclavicular, para-aortic, or superficial inguinal. If you can remember the picture that I have shown you in the initial slides, then you will be able to answer these questions. So again, para-aortic lymph node will receive lymph node drainage from the testes. Deep inguinal lymph node will receive lymph drainage from glans penis and superficial nodes. The superficial inguinal lymph nodes receive lymph drainage from the scrotum. So the lymphatic drainage of the scrotum occurs via the superficial inguinal lymph node, and these lymph nodes drain nearly all cutaneous lymph from the umbilicus to the feet, including the external genitalia and anus. The exceptions are the testis, glans penis, and the cutaneous portion of the posterior calf. Lymph from the testis drains directly into the para-aortic lymph nodes. Lymph from the glans penis and the cutaneous portion of the posterior calf drain into the deep inguinal lymph nodes, and the superficial inguinal lymph nodes can also drain into the deep inguinal lymph nodes in a later stage. So this is about the seminiferous tubule, the different type of cells present. So spermatogonia maintain the germ cell pool and produce primary spermatocyte. They line the seminiferous tubule and they are the germ cells. The Sertoli cells secrete inhibin B, which inhibit the FSH. They secrete androgen binding protein, which maintain the local levels of testosterone. They produce the Mullerian inhibiting hormone. The tight junctions between the adjacent Sertoli cells form the blood-testis barrier, which isolate the gametes from autoimmune attack. Now, this statement or this line will give you the answer of the previous question that we have discussed. It will support and nourish the developing spermatozoa and it will regulate the spermatogenesis. It is temperature sensitive, so it will decrease the sperm production and decrease the inhibin B if there is increased temperature. So there is a so it lines the seminiferous tubule and they are the non-germ cells. It can convert the testosterone and androstenedione to estrogens by aromatase enzyme. The Sertoli cells are temperature sensitive. They line the seminiferous tubules and they support the sperm synthesis. Remember, they are the supporting cells. They do not make sperm. Sperms are made by spermatogonia. So Sertoli cells are supporting cell and they form the blood-testis barrier. The Leydig cells secrete the testosterone in the presence of luteinizing hormone, and the testosterone production is unaffected by temperature. Now, this is the basic uh, pathway of spermatogenesis and all. You can see that the hypothalamus produces the GnRH, which acts on the anterior pituitary to form the LS and FSH. The LS acts on the Leydig cell to produce testosterone. Now, this testosterone will act on the androgen binding protein. Right. Now, this androgen binding protein will be used in the formation of the sperms. And again, the FSH will act on the Sertoli cells. And the Sertoli cells will also stimulate the androgen binding protein, which will again stimulate the spermatogenesis process. So we have discussed about the spermatogenesis, the different stages, how it is formed. So this picture is just for your review, and this is about the histological feature, which is very rarely asked in the examination, but you have to know about it. How we can identify this histological picture is that in the lumen, you can see the sperm heads that are purple in color, and you can see the rest of part of the sperm, which is just like a hair-like structure extending from the head. And there will be a basic vignette, clinical vignette, that will be given along with the histology image, so that you will be able to identify the this picture in your examination if it ever appears in your real examination. So again, spermatogenesis begins at puberty with the spermatogonia. Full development takes 2 months, and it occurs in seminiferous tubules. It produces the spermatids and that undergo spermatogenesis to form a mature spermatozoa. So there is spermatogonium, which is diploid. Again, now this passes through the blood-testis barrier, which is a tight junction, and the primary spermatocyte is again a diploid. There is only mitosis occurring, okay? And again, there is secondary spermatocyte, which is haploid. So it has one N and two C, okay? Now, there is meiosis occurring here. And when the meiosis is complete, there will be one N and one C, okay? Now, this completed spermatid or completed meiosis, one will lead you to spermatid formation. And when the spermatid will have morphological changes, acquiring the middle piece, the tail, the acrosomal cap, then it will form a mature spermatozoon, which is again a haploid structure. So N is diploidy and C means the number of chromatids. Thank you for watching. Keep studying hard.